Okay, now we will move on to the parathyroid gland. Where is the parathyroid gland located? Same here. Yes. Where is the parathyroid gland located? Even the largest thyroid gland is here. This parathyroid gland is the smallest one. Where it is located? Behind the thyroid gland. How many parathyroid glands we have? How many parathyroid glands we have? Yes. How many? How many? Two pairs. Two pairs. We have two pairs of parathyroid glands. Okay. So what are the hormones produced by the parathyroid gland? What is the hormone produced by the parathyroid gland? Parathyroid hormone. Okay. So this parathyroid hormone, its main function is in the calcium homeostasis. In the sense, it is going to do the regulation of calcium balance in our body. This is going to do the regulation of calcium balance in the body along with the help of calcitonin. Calcitonin is produced from the parafollicular cells of the thyroid gland. But parathyroid hormone is produced from the parathyroid gland itself. Okay, clear? And before going into the homeostatic mechanism, we will see the variations of the parathyroid hormone. Hypoparathyroidism and hyper. Hypoparathyroidism you will see as tetany. What is tetany? What is the classic significant appearance in tetanic person? What is this appearance? Don't comment on my drawing, okay? What is this? Tetanic hand. What you call this as? Obstetric hand or Accouch's sign. So the person who is tetanic will have their hand always like this. If you see the gynecologist who she keep on delivering the baby, her hand will be like this. That is why it is called as obstetric's hand. Okay, so this is the classic significant feature you will find in the person with tetany. It is due to the hyposecretion of parathyroid hormone. And along with this, the person will have the features like tingling and numbness of extremities. And the person will always have muscular cramps because of parathyroid hormone deficiency, which will not maintain the calcium homeostasis. Because of the calcium deficiency, the person will have the symptom of muscular cramps. And this case, the neuromuscular excitability is increased because of imbalanced calcium level in the body. That is the reason for this muscular cramps. and then there will be laryngeal stridor due to calcium imbalance. So these are the classic features you will see in the tetanic cases. Okay, and other thing what you have to see is hyperparathyroidism. Okay, in this case there will be high serum calcium level. Okay, so what this will do is, normally the role of parathyroid hormone is to maintain the calcium balance. So in case of excess of parathyroid hormone, so it will make the serum calcium level to be high. So it results in brittle bones. In the sense, if the serum calcium level is high, then wherever the role of calcium is taking place, in the bones, the calcium is removed from the bones because of the parathyroid hormone. Calcium is required for the bones, for the neuromuscular activity, and for muscle contraction, everything. Okay, so all these things are happening at the level of the cells. But this parathyroid hormone will not think about all those cellular functions. Its main aim is to maintain the serum calcium level, the calcium which is in the circulation. Okay, so the parathyroid hormone normally gets the calcium from its store and put it in the blood to maintain the serum calcium level. This is the normal function of parathyroid hormone. If the parathyroid hormone is in excess, then what happens? It will do the osteoblastic activity or osteoclastic activity. Clastic activity, it finished the function of the bones. So no bone formation, resorption of calcium from the bones will take place. So finally resulting in brittle and fragile bones. What you term the condition called as? Osteoporosis, due to excess of parathyroid hormone. It removes all the calcium from its stores, from the bones, everywhere it removes. And if this is also seen in the cavities, you term it as osteitis fibrosa cystica. Okay, and since excess of calcium is remaining in the circulation, so finally this leads to the deposition of calcium in the soft tissues, and that leads to metastatic calcification process. Okay, and since excess of calcium is in the circulation, you will get calciuria. Excess is released from the urine, and you will also experience renal calculi. Okay, and if the calcium is in excess in the circulation, the symptoms you will feel is anorexia, nausea, vomiting, and constipation. So these are all the features where you will see if the parathyroid hormone is in excess. Okay, so the function of parathyroid hormone is to maintain the calcium in the blood. Okay, it will not consider the other functions where the calcium is needed. Wherever calcium is stored, from the bones, from other storage regions, from the sarcotubular system, no calcium, because it is being resorbed by the parathyroid hormone. So neuromuscular junctional effect is affected. The muscle excitation contraction will be affected because calcium is not present in the stores. Okay, so altogether it results in all these features. Okay, so this is what is the parathyroid hormone and its function. And whatever done by the parathyroid hormone, the reverse of it being done by the calcitonin. Since it is produced by the thyroid gland, you also call it as thyrocalcitonin. So it is just the opposite function of parathyroid hormone. Parathyroid hormone is increasing the serum calcium level. Its function is to decrease the serum calcium level. In the sense, it will store the calcium in its stores. Deposition of calcium in the bones. And it prevents the entry of calcium through the urine. And it prevents the renal stone formation. Okay, so whatever you have seen in the parathyroid hormone excess, the normal function of parathyroid hormone is the opposite of normal function of calcitonin. Okay, so based on this, we are going to see how the calcium homeostasis is taking place. You can make this picture in the fresh page. So when you encounter decrease of plasma calcium level, we are going to see the scenarios happening. When there is decrease of plasma calcium level, okay, the first event which will happen is increase of parathyroid hormone secretion. And this parathyroid hormone, it converts this parathyroid hormone, its normal function is to also act on the proximal converter tubule of the nephron, and it performs the activation of vitamin D. Okay, so this increases 1,25 dihydroxy cholecalciferol, and it decreases calcitonin level. Okay, so these are the events which is going to do the scenario now. So what effect this will have on the bone? In the bone, the scenario is decrease of plasma calcium level. Okay, plasma calcium level is decreased. So automatically parathyroid hormone secretion will be increased. Over the bone, it increases the PTH secretion. Then it increases the resorption process in the bone. It means removes the calcium from the stores, and it increases the calcitriol. So altogether, what is the effect you will get from all these things? Increase calcium release into blood. It is not only having the effect on the bone, it is also having the effect on the kidney by increasing parathyroid hormone secretion, increasing calcium reabsorption during urine formation, and altogether decreasing the calcium loss in the urine. It means plasma calcium is restored. And in the intestine also it is having the role. It increases the calcitriol so that vitamin D will go and activate. So it increases the calcium absorption in the small intestine and increasing the calcium in the blood. So altogether this three mechanism will act and it will increase the plasma calcium. Okay, the scenario will get reversed if the plasma calcium is increased. Okay, so parathyroid hormone is having the role in the bone, kidney, intestine. Whether the bone should get deposition of calcium or it should release the calcium. In the kidney, whether it has to reabsorb from the urine formation or it has to release through the urine. Same way in the intestine. The intestine, absorption of calcium from the bolus should happen or it should be excreted. So that is the one determined by this parathyroid hormone and the calcitonin. Clear? And the same homeostatic mechanism gets reversed in the case of increase in the plasma calcium level. So this is how the homeostasis of calcium is maintained in our body.